So the major taxes that the state has now are the sales tax on goods and services, the state income tax, it's a flat rate tax and a relatively low rate. The single business tax, which is going away and will get replaced with something. But our tax system is one that's arguably archaic, and it certainly doesn't connect very well with an economy that has over half of its activity in services. So we have this situation where a lot the one area where we see some growth, services, is not connected with the tax structure. On the spending side, there are two main areas that are causing problems. And the first is not unique to state government. Healthcare costs are rising 2 or 3 times as fast as the economy is growing nationally. Healthcare is claiming a larger and larger share of our gross product nationally, projected to be a fifth of all economic activity in just a couple or 3 years in our country. And it's affecting businesses, it's affecting governments. It shows up in the state budget in the Medicaid program, which is the largest healthcare finance program in the country, larger than Medicare. It shows up in corrections. The state spends $200 million a year for health care for prisoners, inmates in state prisons. It shows up in...
Will you say that again?
$200 million for health care for roughly 50,000 inmates in state prisons. The state, in effect, the state budget is paying for most of the health insurance for school employees because the state budget provides over 80% of the financing. It's also, in effect, paying for most of the costs of the health care for retirees, both school employees and state employees. And it pays for the Medicaid program. 1 in every 7 Michigan citizens receives health care financed by the Medicaid program. And it is, I think the important thing to understand is that the great majority of those receiving this health care are children. They are children of low-income parents. Okay. And so if you look at ways to try to control and perhaps even reduce the spending in Medicaid, it's almost impossible to avoid taking services away from children unless you take the alternative view, and that is you cut what the state pays the providers for the services. And there are limits on what you can do there, and in many areas the state's payment levels are the lowest of any third-party payer, whether it's Blue Cross or Medicare or any of those. So those are the two components: weak revenue connection with a weak economy, and healthcare. And the second spending area is corrections. We are different in the corrections area from our neighbors. That's the one thing we can observe. We have an incarceration rate, which is the number of prisoners per 100,000 population, that is more than 40% higher than the incarceration rate of our other 6, 7 Great Lakes neighbors, from Minnesota on the west around to New York on the east.
And we've been hearing that a lot and reading that a lot in the papers lately, that we do have a much higher incarceration rate than other states around us.
And it's caused by a couple of things. Probably the more important factor is that we keep people in prison longer for a given offense than the average of those other states. Okay. The second and lesser factor is that we send some people to prison for offenses where they would serve a different kind of sentence in another state, perhaps be on tether in their homes or in a community corrections facility. And those people can work and pay for their supervision.
So
you can't do it once they're in prison. So there's a cost advantage if it's appropriate. If we're talking about nonviolent offenders who can reasonably be expected to function as good citizens under strict supervision by the corrections department, to be out working in the community and paying for their supervision, then that's a pretty attractive alternative. Yeah. But the other is that we just plain keep people in prison longer for the same offense. We don't have a magic wand that says this is exactly what you could do, but I think people are increasingly looking at how the other states are handling this and asking themselves, well, what if instead of 30 years they serve 20 years?
And that, I know, is something Senator Cropsey, who's been very involved in the corrections issues for many years and is actually considered a region expert on it. And some of our other senators are holding hearings on that right now and examining that issue going forward, which is obviously something we need to do. And right now I would venture to say, very timely for us to do that.
The financial bottom line, if you could somehow magically make us look exactly like the average of our neighbors, is about $500 million.
A year?
A year.
$500 million
It's a lot
a
of
year
money.
If we were to do something similar to what our other neighbors do with corrections.
And there are various organizations that have looked at this situation. 40% of 50,000 prisoners is 20,000 prisoners. I don't think anyone has put forward a number quite that large, but there are numbers that are getting to that level, coming from the most vigorous advocates for reducing our prison population. I think the governor has put forward a plan that she thinks eventually would reduce the populations by about 10%. And it's aimed primarily at old and ill prisoners who realistically probably don't offer any threat to
and that's always the
us.
bottom line concern, is the threat to the community.
Right.
Well, we're just about out of time now, and we're going to move on to a second program which will be aired following this one. But I think, in summary, can you kind of wrap up what we've talked about in this program about where we are as a state, where we've been, and where we're headed if we don't make some changes as far as the structural deficits are concerned?
Well, where we are is that we have an immediate crisis of sorts on our hands that needs to get solved very quickly, because it's going to have potentially huge impacts. We really haven't talked about this very much, an even bigger problem in the 2008 budget. And as we look out farther into the future beyond 2008, we see year after year a shortfall of revenues compared with the costs of maintaining services as defined in today's terms. So every year, whoever the governor is and our legislature is going to be confronted with a challenge of having to either cut spending or raise revenues, or some combination of the two, to bring the budget into balance, which is a constitutional mandate for them as public officials.
So, as a state, we have some real challenges going ahead, and they're not, most of the challenges are things that have to be dealt with right away. I mean, they're not issues that we can put off as a state anymore.
That's correct.
So the people who offer me sympathy when I'm back in my district are probably correct in doing that as legislators. But it's also a time for us to really review where we've been and where we're going, and maybe make some significant positive changes moving forward. So with that, I'm going to thank you, Tom Clay, for being here from Citizens Research Council. I think you've helped shed some light on the budget challenges that we have as a state, and we're going to have a second program which will follow this one, airing at a later date. But we want people to know that we do have 2 programs on these issues going forward, and we also have some information on the air as we're talking, some charts that hopefully, and graphs that are pictures of where we are as a state and where we're going, that we hope will help all of you as our viewers out there understand. So again, thank you for joining us on From Lansing to the Lakeshore. We really appreciate your joining us, and we appreciate the fact that you're interested in the state budget and interested in helping us as policymakers and legislators look to the future and make some tough decisions. Thank you very much for joining us today.